Are you tired of feeling irritable and depressed? A breakthrough medication may be just what you need. In this video, we unveil the effectiveness of Bupropion in treating these common mood disorders. Bupropion is a widely prescribed medication that has been found to have remarkable success in alleviating irritability and depression. With its unique mechanism of action, it targets key neurotransmitters in the brain, resulting in improved mood, increased energy levels, and enhanced overall well-being. One of the standout features of Bupropion is its ability to address both irritability and depression simultaneously, making it a preferable choice for many patients seeking relief. It offers a promising alternative to traditional treatments, such as selective serotonin reuptake inhibitors, SSRIs, with fewer side effects and a faster onset of action. If you've been struggling with irritability and depression, it's time to consider Bupropion as a potential solution. Join us as we delve into its efficacy, benefits, and potential considerations to help you make an informed decision about your mental health. Discover how Bupropion can unveil a brighter, more balanced future for you. Read on to explore the incredible potential of this medication in treating irritability and depression. Understanding irritability and depression. Irritability and depression are two mood disorders that can significantly impact a person's quality of life. Irritability is characterized by excessive or extreme sensitivity to stimuli, leading to feelings of frustration, anger, or agitation. Depression, on the other hand, is a persistent feeling of sadness, loss of interest, and a lack of motivation. Both irritability and depression can have various causes, including genetic predisposition, environmental factors, and imbalances in brain chemistry. These disorders can significantly affect daily functioning, relationships, and overall well-being. The history of Bupropion as an antidepressant. Bupropion, originally developed as an antidepressant, has a fascinating history in the field of mental health. It was first discovered in the late 1960s by scientists seeking an alternative to existing antidepressant medications. Initially, Bupropion was found to be ineffective in treating depression. However, during clinical trials, researchers noticed an unexpected side effect. It significantly reduced the urge to smoke in individuals trying to quit smoking. This discovery led to the development of Bupropion as a smoking cessation aid under the brand name Zyban. Over time, further research revealed Bupropion's efficacy in treating mood disorders, particularly irritability and depression. It was subsequently approved by regulatory bodies for use as an antidepressant, expanding its potential applications beyond smoking cessation. The mechanism of action of Bupropion. Bupropion's mechanism of action sets it apart from other antidepressant medications. While many antidepressants primarily target the neurotransmitter serotonin, Bupropion works by modulating the levels of dopamine and norepinephrine in the brain. Dopamine and norepinephrine are neurotransmitters involved in regulating mood, motivation, and overall brain function. By increasing the availability of these neurotransmitters, Bupropion helps restore balance and improve mood. Additionally, Bupropion has been found to inhibit the reuptake of dopamine and norepinephrine, allowing these neurotransmitters to remain active in the brain for longer periods. This sustained effect contributes to its efficacy in alleviating symptoms of irritability and depression. Efficacy of Bupropion in treating irritability and depression. Numerous studies have demonstrated the efficacy of Bupropion in treating irritability and depression. Clinical trials have shown significant improvements in mood, energy levels, and overall well-being in individuals taking Bupropion compared to a placebo. One study conducted on a group of patients with major depressive disorder found that Bupropion was as effective as traditional SSRIs in reducing depressive symptoms. Additionally, Bupropion showed a faster onset of action, with some patients experiencing noticeable improvements within the first week of treatment. Another study focused on individuals with irritability associated with various underlying conditions, such as bipolar disorder and attention deficit hyperactivity disorder, ADHD. Bupropion was found to effectively reduce irritability, leading to improved interpersonal relationships and a greater sense of emotional stability. Side effects and precautions of Bupropion. As with any medication, Bupropion comes with potential side effects and precautions that need to be considered. While it is generally well tolerated, some individuals may experience mild side effects such as dry mouth, insomnia, or headaches. In rare cases, Bupropion has been associated with more severe side effects, including seizures. It is crucial to discuss any pre-existing medical conditions or medications with a healthcare professional before starting bupropion to ensure its safe usage. Additionally, bupropion should not be abruptly discontinued, as it may lead to withdrawal symptoms. Gradual tapering under medical supervision is recommended to minimize any potential adverse effects. Comparing bupropion with other antidepressant medications, bupropion offers several advantages over traditional antidepressant medications, such as SSRIs. While SSRIs are effective in treating depression, they may not address irritability as effectively. Bupropion's unique mechanism of action, targeting dopamine and norepinephrine, makes it a preferred choice for individuals experiencing both irritability and depression. Its fast onset of action and potential to improve energy levels provide additional benefits for those seeking relief from these mood disorders. Furthermore, bupropion has a lower risk of sexual side effects compared to SSRIs, which can be a significant concern for many individuals. This aspect makes bupropion a suitable option for those who have experienced such side effects with other antidepressant medications. Case studies and patient experiences with bupropion. Real-life experiences and case studies provide valuable insights into the effectiveness of bupropion in treating irritability and depression. Many individuals have reported significant improvements in their mood, overall well-being, and quality of life after starting bupropion. One patient, Sarah, shared her experience with bupropion, describing how it transformed her life. After years of struggling with irritability and depression, bupropion helped her regain control over her emotions, leading to stronger relationships and increased productivity. Another case study focused on a group of individuals with treatment-resistant depression. Bupropion was added to their existing treatment regimen, resulting in remarkable improvements in depressive symptoms. The study highlighted bupropion's potential as an adjunct therapy for individuals who do not respond adequately to other antidepressant medications. The future of bupropion as a treatment for irritability and depression. As research and understanding of bupropion continue to evolve, its future as a treatment for irritability and depression looks promising. Ongoing studies are exploring its efficacy in different populations, including adolescents, older adults, and individuals with comorbidities. Furthermore, researchers are investigating the potential benefits of combining bupropion with other medications or therapies to enhance its effectiveness. These advancements may further expand the options available for individuals seeking relief from irritability and depression. Conclusion and final thoughts. Bupropion has emerged as a highly effective medication for treating irritability and depression. With its unique mechanism of action, it offers a comprehensive solution for individuals experiencing both mood disorders simultaneously. Its fast onset of action, lower risk of sexual side effects, and potential to improve energy levels make bupropion an attractive choice for many patients seeking relief. However, like any medication, it is essential to discuss its usage, potential side effects, and precautions with a healthcare professional. If you're tired of feeling irritable and depressed, it may be time to consider the unveiling of bupropion as a potential solution. Consult with your healthcare provider to explore whether bupropion is the right choice for you and embark on the journey towards a brighter, more balanced future. Thanks for watching.